Good morning, sir. Good morning, classmates. I am Nicole Bondad. My report is about neurologic and neuromuscular agents, specifically the depressants. The contents are what are depressants, diseases, medications, and nursing process. So what are depressants? Depressants are drugs that inhibit the function of the central nervous system or the CNS and are among the most widely used drugs in the world. These drugs operate by affecting the neurons in the CNS, which leads to symptoms such as drowsiness, relaxation, decreased inhibition, anesthesia, sleep, coma, and even death. Many depressants also have the potential to be addictive. So how does CNS depressants affects the brain? Most CNS depressants acts on the brain by increasing the activity of gamma-aminobutyric acid known as GABA, a chemical that inhibits brain activity. This action causes the drowsy and calming effects that make the medicine effective for anxiety and sleep disorders. People who start taking CNS depressants usually feel sleepy and uncoordinated for the first few days until the body adjusts to the side effects. Central nervous system depressants are used to treat a number of different disorders. It includes insomnia, anxiety, panic attacks, stress, sleeping disorders, pain, and seizures. These are some examples of CNS depressants grouped by the respective drug class. First is in the benzodiazepines. We have diazepam, clonazepam, alprazolam, triazolam, and estazolam. In the non-benzodiazepine sedative hypnotics, we have zolpidem, ezopiclone, zaleplon, and in the barbiturates, we have methylbarbital, phenobarbital, and pentobarbital. Let us talk about benzodiazepines. Lorazepam, a benzodiazepine with anti-anxiety, sedative, and anticonvulsant effects, is available for oral, intramuscular, or intravenous routes of administration. Benzodiazepines are controlled Schedule 4 substance because they have a potential for abuse and may lead to dependence. For its mechanism of action, benzodiazepines are bind to specific GABA receptors to potentiate effects of GABA. So for the adverse or side effects, a black box warning states that concomitant use of benzodiazepines and opioids may result in profound sedation, respiratory depression, coma, and death. For patient teaching and education, patients who receive lorazepam should be cautioned that driving a motor vehicle, operating a machinery, or engaging in hazardous or other activities requiring attention and coordination should be delayed for 24 to 48 hours following administration or until the effects of the drug such as drowsiness have subsided. The illustration shows the lorazepam medication grid. So under the benzodiazepines, we have lorazepam, and for its administration considerations, we have a black box warning. Concomitant use of benzodiazepines and opioids may result in profound sedation, respiratory depression, coma, and death. May cause fetal harm in pregnant women, may cause paradoxical effect in children, used cautiously in elderly and with those with liver dysfunction. For its therapeutic effects, it is used to relieve anxiety, reduce seizure activity, or as a pre-anesthetic. For its adverse and side effects, we have oversedation and drowsiness, respiratory depression, unsteadiness, and fall risk. Overdosage can cause coma and death. Flumazenil is used for overdose. Next we have the barbiturates. Phenobarbital is an example of a barbiturate primarily used as a sedative and to treat seizure disorders. In high doses, it can be used to induce anesthesia, and overdosage can cause death. In the 1960s and 1970s, barbiturates were used to treat anxiety and insomnia, but are no longer used for these purposes due to their serious adverse effects. Barbiturates are a Schedule IV drug under the Federal Controlled Substance Act. For the mechanism of action, barbiturates produce sedation and drowsiness by altering cerebral function and depressing the actions of the brain and sensory cortex. In the indications for use, barbiturates are primarily used for sedation and seizures. And for the nursing considerations across the lifespan, do not use for children less than 1 month of age. Barbiturates may harm the fetus during pregnancy, and we should avoid use in geriatric patients. For the adverse or side effects, patients may experience CNS depression, suicidal thoughts or behaviors, gastrointestinal disturbances, rashes, or some blood disorders that can be fatal. The concomitant use of alcohol or other CNS depressants may produce additive CNS depressant effects that can cause death. For patient teaching and education, the patient should be advised to take the prescribed medication as directed. Patients who undergo prolonged therapy should not discontinue treatment abruptly, as this may cause onset of seizure activity. These medications may cause drowsiness and should not be taken with alcohol or other CNS depressants. Female patients using oral contraceptives should also use non-hormonal based contraceptives during therapy. This illustration shows the phenobarbital medication grade. So we have barbiturates, and under the barbiturates, we have phenobarbital. For its administration consideration, it may be administered orally, intramuscularly, or intravenous. It has a high abuse potential. It should not be combined with other CNS depressants. When therapy is discontinued, the dose should be tapered and not stopped abruptly. For its therapeutic effects, it is primarily used as an anticonvulsant, and it is also used as a sedative and may also be used as a pre-anesthetic agent. For its adverse or side effects, CNS depression, overdosage can cause death, may cause suicidal thoughts or behavior, respiratory depression, for its gastrointestinal, nausea, and vomiting. The next slides are nursing process, particularly CNS depressant, phenobarbital. For the assessment, assess patient's condition before starting therapy and regularly thereafter to monitor drugs' effectiveness. Monitor drug level closely. The therapeutic level is 15 to 40 micrograms per milliliter. Be alert for adverse reactions and drug interactions. Assess patients' and families' knowledge of drug therapy. For the nursing diagnosis, we have risk for trauma related to seizures, risk for injury related to drug-induced adverse CNS reactions, deficient knowledge related to drug therapy. For planning and implementation, do not abruptly stop giving the drug because seizures may worsen. If adverse reaction occurs, immediately notify the prescriber. Give the drug by deep intramuscular injection because superficial injection may cause pain, sterile abscess, and tissue sloughing. Don't confuse phenobarbital with pentobarbital. Tell the patient that phenobarbital is available in different strengths and sizes. Advise him or her to check prescriptions and refills closely. Inform patient that full effects don't occur in 2 to 3 weeks, except when loading dose is used. Advise the patient to avoid hazardous activities until the drug's CNS effects are known. Warn the patient and parents not to abruptly stop taking the drug, and tell the patient using hormonal contraceptives to use barrier method birth control. And for the evaluation, patient is free from seizure activity. Patient has no injury from drug-induced adverse CNS reactions. Patient and family state understanding of drug therapy. These are some points to remember. Prescription CNS depressants are medicines that can slow brain activity to treat anxiety and sleep disorders. Prescription CNS depressants act on the brain by increasing activity of GABA, a chemical that slows brain activity. People who start taking prescription CNS depressants usually feel sleepy and uncoordinated at first. They can also have poor concentration, confusion, lowered blood pressure, and slowed breathing. A person can overdose on a prescription CNS depressants. Flumazenil can be used to treat benzodiazepine and sleep medicine overdoses. Body temperature, pulse, breathing, and blood pressure should be monitored while waiting for the drug to be eliminated. Prescription CNS depressants, use or misuse, can lead to a substance use disorder, which takes the form of addiction in severe cases even when used as prescribed by a doctor. Withdrawal symptoms may include seizures, shakiness, anxiety, agitation, insomnia, overactive reflexes, increased heart rate, blood pressure and temperature, hallucinations, and severe cravings.